Hello, hello, and good afternoon, everybody. Thank you for joining us for our presentation today. One in a series of how to launch your insurance business. We are going to be covering not only the ACA, but under 65 insurance today in general. A few housekeeping rules before we get started, but I do want to get underway as we want to try to keep this punctual for you guys in around a 30-minute time frame. So everyone should have been muted upon entry into the room today. If you find that you have an echo, for whatever reason, it's been very common lately for Zoom to open multiple instances of the same webinar. So if you're experiencing an echo, that is likely on your end. Please check if you have multiple webinar rooms open. What we're going to be covering today is, again, how to launch your business with under 65 products. My name is Alex Ferron. I'm a senior marketing rep here at JSA. I'm going to be covering the first section, which is going to be a little bit of 101 about these products, and then Kathi will go into how to do some grassroots marketing, prospect, how to find clients who are good eligible clients for this type of business. A quick breakdown of everything that you need to know to get started. The presentation today will be recorded. Everyone's going to receive a recording in the follow-up email, as well as some additional resources for you guys that I'm sure you'll find helpful. So don't worry if you have to duck out early or you miss a part of this. So we have a bit of a long presentation, so I'm going to breeze over a few things. And then when Kathi picks up, we want to focus more on the building a business and marketing side of things. So let's get going. This is intended for you to make clients for life. We have our Green 365 training program available on the Agent Resource Center. That stands for Get Ready, Engage, Enroll Now, 365 days a year. If you are looking for any sort of additional training, please go to our Agent Resource Center and check that out right now. We have a bunch of videos on demand for under 65 products. So let's start with ACA and Short-Term Medical 101. These are going to be your two primary products in working with the individual under 65 market. So what we're going to talk about are some short-term medical plans the company's offered, benefit structure, and networks for both types of products. We have a quick comparison between ACA and short-term medical, and then I have a case study exercise where we would compare quotes between the ACA and short-term. We'll see where we're at with time when we get there today, but otherwise, if anybody wants more of that, please feel free to reach out to us. We are more than happy to do quotes and comparisons for you guys. Okay, so kicking it off first, let's talk about short-term medical. And I just want to say, in no uncertain terms, if you're going to be working in the under 65 market, it is a good idea to familiarize yourself with, of course, the Affordable Care Act, ACA, Marketplace Insurance, Obamacare, whatever name you want to go by. Those are all interchangeable. But not only that, but familiarize yourself with short-term medical. These are a very viable product in the under 65 market. They're not available in all states, which is important to remember. However, they are often a really good gap coverage or budget option if somebody is paying too much for the ACA. To put it plainly, this is a year of high-priced ACA plans. We saw some record ACA numbers in terms of premium increases for this year. So more and more clients, I think, are searching for alternatives to the ACA. So short-term medical in general, I would say think of short-term medical as your sort of safety net. It is catastrophic insurance. In the event that somebody has a health fallout, short-term medical is going to be a good budget option compared to a full-price ACA plan to make sure that your clients are not left with unlimited out-of-pocket exposure. As you can see on the screen, these are underwritten products. This is definitely a difference when you compare it to the ACA. So short-term medical being underwritten, ACA being a guaranteed issue, that is going to be one of the main differences between these two types of insurance. Here are the companies we currently offer: United Healthcare, Pivot Health, WPS in Wisconsin only, and National General, which is now Allstate, although you might still see some of the National General branding. These plans can go anywhere from 30 up to 364 days worth of coverage. It's a term type of insurance. So they will reset after the term. They are not infinitely renewable. Your client is going to need to pass underwriting every time they take one of these. But the cool thing is that in 2024, we saw these reduced in term options, Now, just since this past year in August, we saw CMS say, hey, we're not going to enforce that anymore. So now these are available in many states for 6 months to a year to up to 3 years of coverage. So again, they are becoming an increasingly viable option and alternative to the ACA if you have clients that can't afford or don't want that type of insurance, but are healthy enough to get a short-term medical plan. As a plan design, it's going to be very similar to the ACA. Your client will start with a deductible. These are high deductible plans. After they meet their deductible, they'll go to a cost sharing phase, such as copays or co-insurances, up to an out-of-pocket maximum, and then the company will pay up to the policy limit for that term of insurance. Most of them are going to sit around 500,000 to $1 million. If the company were to pay out your client for over $1 million on their claims, then they are responsible for the rest of that, they being the client. These plans will often come with or without prescription drug coverage, network or non-network, and by non-network, I mean reference-based pricing. The takeaway here really is that these plans have much more flexible networks than the ACA. They are primarily PPO networks that operate off of the Aetna or Cigna national PPO networks, which are huge networks. They both have more than like 50,000 providers. Very flexible. This slide is really just to demonstrate that the lower the premium, the higher the premium, you are going to be able to seriously customize these. If you need to keep it budget friendly for your client, you can go with a higher deductible and higher copays. Whereas if you have a client that wants a more robust plan, keep that deductible low, keep the cost sharing low. You can really tailor these to fit any client. So this is really just an example of a short-term medical plan. To quickly demonstrate here, we have the deductible phase at the top. Then you would go to your co-insurance phase up to whatever the plan pays. This is from United Healthcare. If you'd like to take a quick look at this, this is really just sort of your boilerplate example of what a short-term medical plan looks like. And in the same vein, here we have the prescription coverage for those United Healthcare short-term plans. Very simple. Most plans are going to operate with either a discount program or a basic formulary tiered style of coverage. Super familiar if you're already working in senior healthcare. One important thing to remember, short-term plans do not cover pre-existing conditions. They are medically underwritten. If your client has a pre-existing condition, it will not be covered. That includes prescription drugs. So if you already have something that has been prescribed to your client and they take the short-term plan, make sure they understand that they're going to be paying out of pocket for that medication. Only newly prescribed medications on a short-term plan are what's going to be covered by that term of insurance. Another slide, just for your reference after the fact here, some quick comparisons between our three top carriers. If you are, at a glance, looking for a good carrier to jumpstart your business with, I would personally say United Healthcare or Pivot Health are great first choices, very easy to work with, and a lot of plans in the vast majority of areas where they're available. Pivot Health or United Healthcare, we offer both of these and can help you guys out with contracting if you have any questions. Short-term plans are primarily for your 18 to under 65 market. Like I said, we are talking about under 65 insurance today, but these plans have a strict cutoff, very strict. You are not getting a short-term plan if you are 65 or older. Some companies like Pivot Health also offer child-only plans down to the age of birth. So very flexible with the sort of demographic that you can provide these to at the very least. Here's just a quick example of some of the state variations that you might see if you're working across multiple states. A good example here is if you look at Vermont, they're only available for 90 days at a time, whereas if you're selling in West Virginia, Wisconsin, or Wyoming, you can actually write these for up to 364 days in a term, or in West Virginia and Wyoming, 36 months at a time with what we call a tri-term plan. To briefly cover the ACA, the Affordable Care Act plans, marketplace plans, exchange, Obamacare, whatever you want to call them, these are your more renewable, comprehensive, long-term individual plan options. They are oftentimes available year over year and will re-enroll that client if it's available. They do not have any sort of pre-existing condition exclusions, and they will cover your client's prescriptions as well. At a glance, we don't have to go over this too much, but just know that the ACA has been around for 16 years now. Since it was first introduced, about 8 million people enrolled. Now, the past open enrollment, we saw more than 23 million. And that was actually a slight drop off of some of the changes. It was, I believe, closer to 24, 25 million the year before. However, more and more people are coming off of Medicaid within the next 9 to 10 years. We are seeing increased interest in the ACA every single month. A lot of opportunities here right now. We expect open enrollment numbers to continue to go up from this point onwards. Some of the common terms you're going to see here that I want to hit on quickly are subsidy and cost sharing reduction. Subsidy is really what you think of when you think of the ACA. If you hear people say, well, my plan isn't very affordable on the ACA, it's probably because they are paying for a full price plan or they're getting very little in subsidy. Subsidy is technically called advanced premium tax credit, and it's what your client receives from the government to help pay for their plan every single month on an automated basis. It's calculated based on their tax return regarding their household income and their household size. So that is really what makes the Affordable Care Act affordable. And as an extension to that, we have cost sharing reductions or extra savings. You will see these front and center if you're running a marketplace quote, and it will be only for the silver tiered plans. The market operates on a bronze through a gold plan structure in most areas. It's just a very simple way of looking at a plan and saying, okay, this one is more benefit rich. This one is a little bit weaker in what it covers, but maybe it's less expensive like a bronze plan. Cost share reductions are only available on silver tiered plans, and in addition to lowering the premium, they're going to lower that maximum out of pocket for your client, lower deductibles, and lower copays to make that thing overall much more affordable. If you have a client looking for HSA plans, all bronze plans this year are HSA eligible. So don't worry, you have an option for HSAs with the marketplace. Here is a quick example of what the federal poverty limit chart looks like. Really what you're looking at are those top and bottom numbers. If somebody falls between 100 and 400% of the federal poverty limit, they are going to be eligible for subsidy. I'm putting this one in here as a reference for you guys if you would like to look back and go through the presentation. For who is eligible, you just have to be lawfully present in the US, either a citizen, a green card holder, or most of your visa holders are going to be eligible. Commonly, you're looking at student and worker visas, which are K1 and J1 visa holders. They have temporary tax ID numbers. They can get the marketplace. If you are over 65 without premium-free Part A Medicare, you can also enroll in the ACA, unlike short-term medical. If you're going to get in, you don't need to do underwriting. These are guarantee issue plans, but you do need to apply during open enrollment or have an SCP, kind of like an MAPD plan. So just think of them as needing an eligible election period or qualifying event to apply. Your best first step as an agent, if you want to get involved and build your business, not only with senior health, but ACA plans, is to get certified. The federally facilitated marketplace certification is available now. It will certify you for the rest of 2026, and when 2027 rolls around, you will have a vastly reduced course load, make it much easier on yourself if you want to get certified now. If you're working in a state like Colorado, Washington, or California, for example, you might have your own state-based exchange that you need to use, not the federal marketplace. Generally, these are no cost to agents. If you have any questions about the states that you're working in, Kathi so graciously put our email in the chat. That is aca@jsaonline.com. Shoot us an email. We can tell you exactly what you need to do to get ready. Here's a quick comparison between the two. If you'd like, please go back and feel free to check this out. My next two slides are going to be the case studies, and in the interest of time, I would just like to say we also have a more in-depth 101 where we are really diving into this stuff on Thursday. That is going to be at 1 p.m. Eastern Time. Go check that out on our events page. I'll include that in my follow-up email as well. If anybody wants a deeper dive on the actual products and plans, the 101 of it all, go check us out on Thursday. We're going to be really diving into that. I'm going to skip my case studies here. These are more of just a quick example of what those clients should choose, and I'm going to pass it off to Kathi Wilson. Kathi, take it away.
Thanks so much, Alex. I'm going to wrap this up. We've got 15 minutes left on our webinar, and I'm going to go through how to get your clients if you're interested in selling ACA. So, part of our Green 365, which is located on the ARC, will cover a bunch of different ACA marketing 101, short term medical, and any training that you might think you might need. We also have flyers available on our pro shop. So, network and marketing strategies in the ACA space. First of all, I would just say keep doing what you're doing if you're doing grassroots for Medicare or your other line of business, mapping out your community and figuring out who are the uninsured. So, who's falling in between that gap between becoming Medicare eligible and before that? Because now we're looking at cradle to grave, right? From birth to end of life, and you can capture the entire family with all of these different segments of business. Where do you go to find them? So, we're going to cover that. And then I'm going to give you a list of organizations where you can start looking at and familiarizing yourself because what you want to do is become a resource to your community. And I'm going to let you know once you find those places, how to approach them and what to do when you get there. Also, going to go through some free lead sources. A lot of agents will use that to get clients, some action plans that just will reiterate that Alex went over as well. So, who are the uninsured? We're going to talk about self employed individuals, 1099 brokers, agents, gig workers, all who need individual coverage that don't have, let's say, a group or an employer that's going to offer that to them. So, small business owners who might need employee plans or individual coverage, low income individuals who do qualify for a subsidy and could have a $0 plan that need guidance on how to get it, young adults and first time buyers who may not understand ACA option. And to know that there are options available is part of the education when you're dealing with maybe small business owners that are new, self employed individuals that are new, low income individuals who have just hit that subsidy mark, and of course, our young adults. It's all about educating them on what's available to them. A lot of myths are I can't afford it, I make too much, it's going to screw up my taxes. All of those are wrong. So, where are you going to find these individuals at, or groups, or communities? You're going to look in your own backyard. You're going to find places of service that have staff or clients who need ACA, but just don't know where to start. You can start with a flyer and just hand that out to start surveying. Does this establishment offer insurance? Things that you would be surprised at: hospital staff, like janitorial staff, they don't have insurance. A huge win is again through education, because if you can educate the community, then you can become the resource. You might want to look into community health centers, nonprofit organizations that serve ethnic or immigrant communities that are, of course, U.S. status that Alex had explained, housing assistant programs through the Housing Authority, job centers, of course, your doctors and providers that accept these plans that are in your area. You might want to see where the free phone distributors are at, or entrepreneurs that are self-employed market, small mom and pop stores and restaurants, salons, ethnic and cultural communities, events and restaurants, free clinics, and your behavioral health centers. Education is the key for this. So once you've identified some places, and with ACA, some of the guidance and guidelines and compliance, it's different than maybe Medicare that you're used to. You can door knock, you can tap someone on the shoulder, you can ask a question. Those compliance guidelines don't exist. There are some complaints as long as you're being truthful about the product, but you can approach individuals very that differently. And this opens up a lot of opportunities for you. So here's what I would suggest, and I have done and taught agents to do: to start to canvas in your own backyard using your own one zip code, or if there's a zip code you want to hit. Don't go during peak times to make sure it's not lunchtime or breakfast time. Don't call, but bring in a gift maybe and say, hey, I'm a community agent, and just surveying to see how many individuals might need insurance. If it was, to see if they qualify for free insurance or $0 insurance. Introducing yourself again as a community agent, that kind of gives you a broad title for whoever you're trying to sell to, whether it's life insurance, ancillary, Medicare, health insurance, ACA, short-term medical. Keep it brief and let them know that you're just here to help the uninsured get insured. It could be you could really quote somebody on the ACA marketplace, Health Sherpa, or state-based exchanges within 5 minutes or less. Offer to treat the staff maybe with a coffee or breakfast or lunch, and decide, is this a place to educate or set up a tabletop? So going back to a little bit of grassroots with Medicare, a tabletop is somewhere you would sit outside, like a Golden Corral, dollar store, where you've gotten permission to do so, flea market, produce market, things like that, where you can talk to the general public and see if there's any uninsured individuals there. Free local help. So when you sign up for Health Sherpa, you can also go to CMS, the MLMS profile. Again, we're going to have more on this in our in-depth 101, and I'll share with you some boot camps that we have during the summer season. And once you sign up for this, you'll turn it on, and when someone clicks on find local help, that's when your number will pop up, and it's free. So these are free lead sources. Another one is help on demand. Same thing, that actually rings to your phone or texts you or emails you. You have 5 minutes to accept it, to pass it on. Again, a lot of individuals, agents I've talked to, they rely on this lead source. You can purchase leads. You could use grassroots, $0. You can purchase leads by any of our trusted lead sources. You've got to feed it. You've got to do a certain amount to get the return on investment that you would want. So that's something you can definitely look into. And now a quick get ready action plan. Alex spoke about this before. Certifications will be closing sometime. They let us know usually the week before. They'll take a week or 2 minute break and they'll reopen for 2027. So every year, the federal facilitated marketplace certification will need to be completed. It's shorter for returning agents and brokers. Also, with your state based marketplace training, if you sell for a state-based marketplace state. So half of the states are on the federal, half of the states have their own individual state-based certification and platform. So just be aware of that one certification doesn't cover all. It's individual states. And we can ask you that at the time that you want to get contracted. Please confirm with us or the carrier that you are ready to sell. Just because it shows up on your portals or your platforms doesn't mean that you have a contract and are ready to sell. It does not verify with the carriers. Test your healthcare.gov, Health Sherpa, or your state-based exchanges to make sure your logins are correct, that you've integrated the right way, and you're ready to quote. Important numbers, and we'll provide you at the time when it's OEP with the correct consent form that's going to be actually revised for 2027. Health Sherpa team number. If you're using Health Sherpa platform, unfortunately, we don't have control of that, and that would be a technical issue with them. The marketplace call center number, it's an 800 number. This is where you would become the new agent of record if they have not given you access online to do so. And of course, the very most important number is our agent relations team at 800-203-0433. If you haven't used this, guys, just know that there's 4 different buildings that we house our agent relations, part of JSA's team at our headquarters, and they are there just to take your phone calls for any line of business that you might have. They will run formularies for you. They will help you find a plan. We have compliance, contracting, commissions department, anything you need. So how do you prepare for next OEP? Well, there's no time frame where you can't talk about it. So we don't want to be too early, but we definitely don't want to be late. So you can start reviewing your book of business. Schedule your pre-OEP emails, texts, or calls. We unfortunately don't know the carriers that's going to populate in 2027, so it's impossible to quote them. But we do know, the type of individuals that you might have, and you can start preparing any flyers or mailers, social media, community outreach. You can send texts or emails, phone surveys to find out if anything's changing with their income or if they're, you know, going to any changes with their family or income. And then you can set up autoresponders. If you're using one of our CRMs like Core, you can, have AI do all this stuff for you so that they can be your assistant and respond quicker. I mentioned this before, but if we do have flyers available on the Pro Shop, if there's something that you don't see, we have an incredible design team and a part of our marketing team that really can create whatever you want at no cost to you. And you just take care of the printing. Important dates to remember. We believe that this is final. ACA is ever changing, and we're trying to report on that as soon as we hear the news. But as for now, it stands November 1st to December 15th as OEP for a January 1st start date. So make sure that you log on to Health Sherpa. And due to time, we're going to kind of quickly go through this. This is for the federal marketplace. This is how you're going to log in and quote your clients. And this just kind of goes through a two-factor authentication. It's like everything does to get you in. You have to integrate into CMS every 12 hours, and it's going to prompt you to do that. So don't worry about it. It'll be a quick step. And again, we can go into this a lot more thoroughly, but just a quick snapshot of what it looks like to quote. You click on quote on exchange. You put in the household income, the household size, the zip code, date of birth, or age, sex of the person, male or female, and it gives you a quote. The 455 that's circled in the right-hand corner is going to be the discount off of the monthly premium. Then you add it to the cart. You can add your providers and your prescriptions as you see on the left-hand side, and you go through the application. This year for 2007, documentation will be required, and be prepared. We have a checklist, part of our ACA playbook, that tells you everything you need before you sit down with your client. There's a few things on Health Sherpa where you can go through, and marketing's one of them, where you're going to find a QR code and a link that you can send people for self-enrollments, special enrollment periods. They're a lot more than probably Medicare, a bit different, easier to use. But what we do know going forward, that SEPs need documentation, loss of income coverage. So if they've lost coverage, if they move from one area to the other, they have to have an ACA plan in order to switch a plan. Birth, marriage, immigration status, release from jail, change in affecting eligibility, loss of Medicaid. All of these things need documentation. There's a family glitch rule. We'll go more into it, but it basically says that if the coverage must be affordable for dependents to disqualify for them for the ACA subsidy. If the employee only plan is affordable, but the family plan is not, the dependents may still qualify for subsidies. And again, it goes into more of an affordability threshold. So these are SEPs that can go connection with an SEP to get someone into who may have an employer plan, because there are guidelines around that. And to leave you, if you would like more information, we have a podcast once a month, because I mentioned that ACA is ever changing. We are staying on top. Alex and his big, beautiful brain, and I'm an ex-broker, get together and real talk about what's happening with the guidelines, the changes, what's ever happening, so we can let you know when blackouts happen, when they don't, what are the new requirements, what's changing, so you can know in real time. That's going to be once a month, the first Thursday at 1 p.m. Eastern. And you don't want to miss this. If you are new to ACA, or maybe only written a few just because you fumbled through it, this is a perfect opportunity for you to join us for an in-person live training. We're going to cover ACA, short-term medical, and ancillaries. We're going to do live quoting on each other and have real scenarios that happen of what you can do, what you can't do, things like that. We're going to be in Fort Myers next week on June 18th. We're going to be in Arlington, Texas on July 23rd, Long Beach, California, August 20th, and Green Bay in September 17th. So seats are limited. We're only doing this for one day from 10 a.m. to 2 p.m., but I promise you don't want to miss this. Thank you for joining our training today. Alex, do we have any questions that we can address? We're 3 minutes after, but thank you so much, everyone, for joining today.
All right. So I tried to answer a few in the chat as we were going along, just in the interest of time. And again, everyone, you'll get a copy of this today. I know we went quickly, and definitely check out our Thursday. We're going to be going into all of the stuff more again on our Thursday presentation. That's going to be 1 p.m. at Eastern. Couple quick questions here. Emily said that the CMS login page changed for the verification with Health Sherpa. Thank you for the heads up, Emily. Trinette said, do they need to be at the end of the allowable COBRA period, or is there an SEP if the client no longer wants to pay COBRA premiums? A quick answer to that is, if they've already elected COBRA coverage, they have to run it for the full duration before they are eligible for the ACA again. or they need to sign up during open enrollment. But generally, you want to really make sure that a client is choosing the right option for them when they lose their group coverage between Cobra and the ACA. But long answer is, feel free to give us an email or a call. We can give you a more in-depth answer on that. The short answer is they need to wait for it to run out. Ingrid, how do you sign up for the CA bootcamp? Feel free to reply to our follow-up email, which will be today or tomorrow. All of the signups are in both Kathi and my signature in the email, so the links will be right there. Feel free to check them out. Trinette and Ingrid, thank you so much for joining us. Appreciate your time today. I think that's all we have so far, Kathi. Good job getting through that. That was a quick one.
Thanks so much, guys. Hopefully,
Thank you,
we'll see
everyone.
you at the boot camp or on the podcast or on the 101.